The HIV and AIDS pandemic was first diagnosed in Zimbabwe in 1985. This is back at a time when people had little to no knowledge of this disease at all. Most people would be diagnosed with the disease after presenting to health facilities with other opportunistic infections like tuberculosis, herpes zoster, Kaposi sarcoma, severe diarrhea, and the likes. Unfortunately, during this time, there was no treatment yet available. Most of the patients advanced to AIDS, and a lot of them succumbed to the disease. During this period, the virus was largely prevalent in the economically active age groups of 17 to 30-year-olds. And as we saw with COVID-19, when people have a limited understanding of a viral infection, there tends to be a rise of stigma. This only got worse with the rise of the awareness campaigns that were happening at the time, which employed the use of fear. So a great number of people suffering from the disease shied away from getting testing as they were afraid of being stigmatized by their family and those close around them and the community at large. It would only be in the 1990s when the HIV and AIDS virus became a public discussion at a national level. In 1998, the government crafted the statutory instrument 202 of 1998, in which it prohibited the discrimination of people living with HIV and AIDS. The government would go on in setting the National AIDS Policy in 2000, which also saw the birth of the National AIDS Levy and the roadmap to which how HIV would be fought in the years coming after. The years after this would see a rise in the efforts to try and curb the HIV and AIDS pandemic. The government, in conjunction with civic society and non-governmental organizations, gave concerted efforts, and there was the rise of mass education, mass campaigns, and even the inclusion of the HIV and AIDS pandemic into the academic syllabus for all learners to understand. There was also the use of media. A lot of us remember Studio 263, which is largely based on the HIV and AIDS pandemic. Artists like Oliver Mtukudzi took a center stage to educate people on HIV and AIDS. There was also the initiation of prevention of mother-to-child transmission of HIV and AIDS. All the mothers who were expecting and registered would get tested, and those found positive of HIV would initiate antiretroviral treatment, better known as ART. This prevented the vertical transmission of HIV to newborns. These efforts would see a reduction in the prevalence of HIV and AIDS in our community. However, unfortunately, from the period of 2005 to around about 2008, the economy of Zimbabwe faced large challenges and the health sector nearly collapsed. We would see a large brain drain of professional and skilled people leaving the health system of Zimbabwe. And unfortunately, during this period, as a result of the socio-economic system and the healthcare system, there was a surge in HIV once again. But let's take a look at more recent times. In 2018, Zimbabwe celebrated the mark of 1 million volunteers who had participated in the voluntary male circumcision program. There was also the launch of the pre-exposure prophylactics program, better known as PrEP. These two milestones are worth celebrating as they are high indicators to the possibility of an HIV-free generation in Zimbabwe. Circumcision in males reduces the chances of contracting HIV up to 60% during heterosexual intercourse. In 2020, the Zimbabwe Population-Based Impact Assessment Program was carried out. This is better known as ZIMFIA. This program conducted the free HIV testing and counseling of individuals in Zimbabwe with the return of results. This survey offers the latest HIV and AIDS statistics in the country. According to ZIMFIA, about 1.4 million people have HIV in Zimbabwe. The HIV prevalence between adults of the ages 15 to 49 is 11.8%. The survey also revealed the gender disparity of HIV infection in Zimbabwe, which is highly pronounced in young women between the ages of 20 to 24, whose HIV prevalence of 8.1% is 3 times that of the males in the same age group, whose HIV prevalence is 2.7%. Let's take a look at the future. An HIV-free Zimbabwe is actually much closer to us than we can imagine. And we might not even need to wait for the cure of HIV, but rather have an end to the transmission and new infections of HIV. See, HIV is a retrovirus. This basically means that HIV works by integrating itself into the DNA of infected cells, which allows it to replicate and infect other cells. HIV has also mastered the art of evolution and evading the human immune system. Well, these factors make it very difficult for us to have a cure to HIV or a vaccine program towards HIV. However, in comes antiretroviral therapy. Antiretroviral therapy, better known as ART. These are medications which work to prevent either the infection of HIV into new cells or prevent the replication of HIV. Because of the factors mentioned above, a patient who is on antiretroviral treatment will get to a point where they have a reduced viral load in their system, better known as undetectable. An undetectable patient is still HIV positive, but they have such an insignificant amount of HIV viral load copies per milliliter of their blood, such that they are referred to as undetectable. An undetectable patient is unable to transmit HIV to other people during heterosexual sex. So basically, an undetectable person is untransmittable. Notably, Zimbabwe has already achieved the 90-90-90 goals set by the World Health Organization. Well, this basically means that 90% of all HIV positive individuals in Zimbabwe know their status. 90% of those who are HIV positive are on ART treatment, and 90% of those on ART treatment are now undetectable. This is amazing news, and Zimbabwe has set the bar higher, which means we are now chasing the 95-95-95, in which we aim that 95% of all the HIV positive people in Zimbabwe know their status. 95% of those positive get on ARV treatment. 95% of those on ARV treatment become undetectable and untransmissible. Antiretroviral treatment can also be used as a preventative measure to avoid contracting HIV and AIDS. This is better known as pre-exposure prophylactics, shortened to PrEP. PrEP works by flooding the system of individuals and preventing the infection of HIV into the cells of these individuals. PrEP is highly recommended to those who are in key groups of HIV infection or key potential groups of HIV infection. For example, men who have sex with other men and those who are involved in sex work. An HIV-free Zimbabwe is possible, and we can do it. But it remains the responsibility of all of us to practice safe sex, to abstain, to get tested for HIV, and if positive, to get on and to adhere to treatment. And we can all beat HIV. Together, we can make a future that is HIV-free.